My name is Carl Stark. I was a longtime health journalist and editor at the Philadelphia Inquirer. My friends refer to me as a journalist in remission. And our goal today is to talk about a great epic subject of misinformation. I'm also a co-investigator with the Policy Corps. So if folks want to reach out for a consultation, I am available. This panel is on misinformation and messaging. And we're going to hear from three panelists who represent different areas of the health communication landscape to discuss the impact on patients, the impact on health, how it creates mistrust, and preemptive and corrective measures that we can take to correct them. Our first guest, Dr. Abike James, is professor of clinical obstetrics and gynecology and vice chair of academic excellence and community engagement at the Department of Obstetrics and Gynecology at the Perelman School of Medicine. As a clinician, researcher, and educator, Dr. James champions maternal health, equitable care, and the empowerment of community members and healthcare improvement efforts. Recently, Dr. James was named the Healthcare Award honoree at the March of Dimes 2026 Greater Philadelphia Salute to Women of Achievement. Our next guest, Alexia Doumbouya, a doula, nationally recognized maternal health advocate and founder and president of Coco.Black, a Philadelphia-based nonprofit dedicated to improving maternal health outcomes for Black and brown moms by addressing race-related disparities and social determinants of health. Driven by her own lived experiences during and following childbirth, Alexia created CocoLife.Black to ensure that moms are heard, supported, and equipped with trusted resources during some of the most vulnerable moments of their lives, using community resources, culturally grounded education, and collaborative partnerships to create a supportive space for moms and their communities. Welcome. And then Dr. Franziska Haydanek, known as Dr. Fran, a board-certified OBGYN with clinical expertise in high-risk obstetrics, hormone management, including PCOS and menopause, and minimally invasive gynecologic surgery with a focus on laparoscopic salpingectomy. As a clinician and mother of three, Dr. Haydanek shares relatable, evidence-based content on women's health, breastfeeding, and parenting across platforms like TikTok, Instagram, and YouTube, with a reach of over 1 million followers. She is the founder of Paging Dr. Fran, a digital platform dedicated to empowering women with practical, science-based health information to support informed decision-making. So, Dr. Fran, how many times did you post this morning?
I've only posted twice today.
Okay.
Which is my typical.
It's a slow day over there.
It's a slow day.
Yeah. Well, we're gonna speed it up. Here's a question for the three of you, whoever wants to take it. Studies have shown that 2/3 of U.S. adults turn to social media for their health information. This is worrying, given that half the U.S. also says it's hard to determine fact from fiction in their news sources. How have you either witnessed or experienced the impact of health misinformation within your own lives? And what was the source of that misinformation?
I can start. So I do full scope OBGYN, but I do a lot of obstetrics. And we're seeing a very large increase in patients who are declining the standards of care throughout their pregnancies, their labors and deliveries, and the postpartum care of their infants. So we're seeing an alarming rise in patients declining, for example, vitamin K for their newborn babies, which we know helps prevent catastrophic brain bleeds for babies. And this is something I now encounter every single day in my practice. And so, when you talk to patients, a lot of times they have a hard time verbalizing why they're declining these interventions that we have that have been proven to be very safe. And the majority of the time, they are citing things they've seen online. And so they're getting their information online from people who are not vetted to give information and making what can be life-altering decisions for themselves and their newborns.
Yeah. I can jump in too. I would echo that. And from a personal and professional perspective, as a doula serving families and then through Coco Life and Serving Doulas, I also see how algorithms reward emotionally charged content and nuanced education. And so a viral video that is one's perspective or one person's experience, but if it's coming from someone who has now garnered the attention of this large population, it now becomes gospel. And so I've seen how that impacts the same decisions as probably a lot of the clinicians are. And so I usually start off with, what do you know? Like in terms of, well, what have you seen? I guess that's the question. And it's really not as different. Well, it's different, but what it made me think about, right, when I compare it to like history is when people used to come with all the books too, of like, I read this in a book and I saw this. And it's like, you got to be able to pull from the actual evidence-based factual, but then you also have to layer in cultural components too, which that could be where it's coming from as well.
Yeah, I was thinking about this, and I think about how I go back to how it changed. And I remember the first time it was like just after COVID when a patient like mentioned to me something that they'd heard from TikTok. And I was like, TikTok for me, COVID, it was just the dancing, right? My kids had done dance, and I went home and I was like, what is this about TikTok? And since then, that was like one patient, but now it's like, I can't go a day without someone bringing me information in the office that they have garnered from online, and have to figure out how to address it. So it is directly there, as both Alexia and Fran have said. And has become a part of practice. I had another first just recently when I'm actually talking to a patient, and as in front of me, they pull up ChatGPT to check on my discussion about surgery. So it's there.
Did ChatGPT get a copay for that, or was it a freebie? Um, Dr. James, here's a follow-up question, a serious one. A major impact of health misinformation is the erosion of trust between patients and providers and health systems. Can you talk us through some of the ways in which you've engaged in community trust building efforts and what those outcomes look like?
Yeah, I think um, before, as I sort of think about the trust piece, yeah, and as much as we talk about how much it is there, I think it's recognizing where the breakdown in trust came from, and really recognizing there have been true historical mistrust that many people are not trusting of healthcare, because of actual things that have happened in the past, that has broken that trust. So I think taking a step back first and recognizing when they come with all of these things, this is because they're seeking a way to impact their own outcome, because they don't have the trust. So the way I have combated that is stepping out to them, going to the community, and really forging true relationships and understanding. So you hear the listening piece a lot. I think it's listening to the patient in front of you, but it's also listening to what the concern is out there, and educating yourself on that. And the best place to get that information is from community members themselves. So through, a community advisory board, through relationships with Alexia, multiple partnerships, she has taught me, and she's trusted within the community, as an example, right? And so she can be that bridge when there is that lack of trust. So that's what I've found is really, making sure you put aside your own sort of biases and ego, etc., and really listen and get your advice and recommendations and the way in which you want to put your information forward from the community itself.
Alexia, let's turn to you as someone who holds the community at the forefront of your work, and you work directly with mothers, but also clinicians like Dr. James and local community groups. What themes are you seeing in messages from health institutions to community members? What successes have you seen in those messages versus failures?
Thank you for the question, and just so thankful for Dr. James and how she models it. And what I thought about as you were asking the question is like the first thing that comes to mind is taglines, with a lot of major health systems. And the overarching goal, as Dr. James said, is to rebuild trust, is to gain trust or rebuild trust in many cases for those communities because of a lot of the historical context. But when you look at some of the taglines that come up, it's about currently taking care of each other. It's about taking care one person at a time. A lot of some, I should say, systems focus on innovation and advancements of tools. Some do talk about prioritizing your health over everything else. But what continues to be the test, if you will, is does the work match the words, right? And so does everything align? And so yes, we see that there are a lot of places that have taken more of an interest in the community and seeing how it can be supportive to it. But then also there's opportunities, and I think this is where the successes and the failures come in. There's an opportunity for them to also explore, was this a top-down approach? Were the people that are going to be executing on these policies and things of that nature also included in the messaging and the design? And I think that's where there's a big opportunity to address. So examples of successes is one in particular, the relationship that we've been able to cultivate over the last like 4+ years through Dr. Abike's leadership with Penn Medicine. And so it went from us as a community-based organization serving as we normally do, to also being able to have a voice in the creation. So not just policy exists and we kind of have to get on board as it relates to doula care, and what some of the interactions with the community will look like, but we've been able to share strong recommendations that have been implemented. And that's resulted in seeing more of our clinicians that have been open to that coming into the community. So when we host our baby showers, and I'm talking events, everything from like a line dance-a-thon that we did to a Dad's Den men's know your numbers type event, we saw our clinicians there. They're doing blood pressure screenings, dental checks. That is helpful. And it always reminds me of an example that I use when training around teachers. When we were all young, if you saw your teacher in a grocery store, you were just like, and they're like, whoa, what are you doing here? Like, you grocery shop, you eat? Because it made them relatable. And so it's the exact same thing. We get excited when we see our clinicians in the community. As a doula, I get super excited when clinicians walk in and they acknowledge us. And so those are some of the successes. The failures, honestly, complete opposite. When things are more transactional than relational, when our communication heavily relies on clinical language. So even the example, like you use of social media, the reality isn't, are people going to use it? They are. Is how can we help to craft the language of accuracy and facts into what is understandable and relatable. And so not just throwing data at people and throwing that clinical language, but we know it's evidence-based and we know that's important. But how do we make sure that those community members, those families, and those doulas also still feel safe and seen and respected, even in the messaging?
Thank you for that. I want to turn to Dr. Fran. You are both a practicing OBGYN and an online educator of evidence-based women's health information. What was the inspiration for moving into this online space? What advice might you give to researchers who want to reach wider audiences but are worried about becoming online influencers?
Yeah. So I prefer the term medical content creator. I don't consider myself someone who's trying to influence anyone to do anything. I am providing information about medicine, really. I started my TikTok account in 2021. I was home on maternity leave with my second child, and I was breastfeeding, and TikTok algorithms start to learn you, and the algorithm learned that I was interested in lactation and labor and delivery and birth control, OBGYN things. And this video came across my feed about this woman who was at a bachelorette party, and she was dumping out her breast milk saying, "I'm so sad that I have to pump and dump." And I was like, "Oh my God, you don't have to pump and dump. Like, there's so many other ways that we can go about this. Like, first of all, the alcohol content is low in your breast milk. You could save it and mix it with other milk. You can use it for other things, whatever." So I was like, oh, well, I had just graduated from my OBGYN residency. So I had a lot of knowledge about OBGYN things, but I was also very interested in lactation medicine as a physician who was breastfeeding. I was like, I'll just make a video talking about what pumping and dumping means and like when you most often don't have to do it. And I enjoyed getting to share that information that I had received from my mentors and my doctors and other physicians who had taught me all these things about lactation. And I saw a lot of mis and disinformation on TikTok, and I was like, well, someone should address these things. So I just started making videos about it. And that's really how I started and really have continued to do for the last 5 years on the different platforms is there's people out there who are putting out disinformation on purpose to misguide patients who have ulterior motives, who are trying to sell you something, who believe things that aren't evidence-based despite being given the evidence. And there's people who just misunderstand certain things because they are the lay public and they don't have training in that. And I want to be able to provide a counterbalance to the disinformation. And I want to be able to be someone who can provide some information for the misinformation so that, another mom doesn't feel that she has to dump out her hard pumped breast milk. And so really my goal is to be like an in-between, like an easy to understand person who can take all the high level medicine and evidence and all of that and bring it down to like where we all are, which is scrolling on our phones and like having the algorithm feed us things that we're interested in and providing the information that I had to get through going through medical school and a residency and behind paywalls now for like medical journals and bring it to the forefront as a way for patients to feel that they're given a little bit more information. I think what a lot of patients struggle with is that their doctor told them one thing and they don't really understand why or where those recommendations come from. And so, like, for example, we recommend low dose aspirin to most of our pregnant patients. And patients are like, well, why do I need to be on aspirin? And then like, don't take it because we didn't take the time to explain it. But I have a video that if you type in low dose aspirin in pregnancy, it's going to come up and there's me with the ACOG guidelines saying like, hey, we have moderate risk factors, we have high risk factors. And if you have two of these moderate risk factors, which a lot of people do, we recommend you take a low dose aspirin. And I've had so many people send me messages over the years being like, well, my doctor told me to take aspirin, but I didn't want to do it. But then I saw your video and now I understand. So I took my low dose aspirin. I made no different recommendation than their own OBGYN, but they felt they had a little bit more information than they got maybe in the office, or I was almost like a second opinion for them. So they heard it again from another clinician and did the thing that their initial clinician wanted them to do, but they just felt they had more information. And that's just been my goal this whole time is give our patients the information that they feel they are understanding why recommendations are made for them. They feel empowered now because they have more information, even if it's no different than what their own clinician had told them.
And since you started, has the misinformation stayed the same, grown, become less?
I mean, my view is probably biased because my FYP loves to show me the disinformation. I do feel there's more of it. There's more content creators out there. There's more people who can see the money that can be made by making content that goes viral. So I feel in the last 5 years it has grown in certain spaces, but I have also seen so many more people who are fellow physicians, other clinicians, PhDs, doulas who are very well educated in these spaces, doing the same thing, making content and trying to reach people where they are. So I've seen a huge boom in professionals trying to also address it, which I think is really wonderful.
Well, speaking of doulas, Alexia, for researchers who want to get their research insights to audiences like yours, how can they connect with people who do what you do?
Well, one of the things I think it's important to consider from a research perspective, or if you're reaching out to the community at all, whether it's the organization or the person or individual, is understanding the channels that we use in terms of how we communicate with our teams with our populations. And so one of the first things that comes to mind is that I have to acknowledge over the past few months, if you will, as things have been shifting and changing around DEI initiatives, it has impacted completely what we see even the involvement of the community is. And so oftentimes we're not necessarily included in the early structuring of the projects in terms of the discussion or what it may entail, not at all times. And again, I'm thankful that we have had the opportunity to participate, but I think that's the piece that you have to think about in terms of engaging with the audiences is one, making sure that the first time that they hear from you is when you're asking for something. Considering even with smaller CBOs, we're expected to carry the burden of trust building without the operational funding or infrastructure, right? So we don't have the same support as larger institutions. One of the things we're constantly differentiating, making the difference between is CBOs, actual CBOs, and nonprofit corporations. And so while we may do a lot of the same work, and even from a quality perspective, we excel at it. And I'm thankful for that. Our budgets are not the same. And so there's some constraints there that come with it. And so if you're reaching out, also reaching out or budgeting to be able to support the initiatives and then doing so proactively. If you find funding, and we literally just had this happen over the last week because Robert Wood Johnson put out a proposal, and we actually, but it was only for CBOs, right? But they were also going to be working on a research project. And we had one of the institutions reach out to us and said, hey, we saw this. We know the work you do. Not only did we want to tell you about it, so they didn't just send an email, they said, we will put our resources behind it to help you apply. That is golden. That is golden because running again these smaller CBOs where we want to focus on the mission, but we do still have to make sure that sustainability is active. Being included, being invited, I think is huge and one of the best things to keep in mind, whether it's research or partnership of any type with community.
And other thoughts from you all about ways to structure research projects and dissemination plans to best reach people like Alexia's audience?
Yeah, I mean, I think definitely bringing them in. Alexia sort of covered that, right? So having that thought even before you have the project at really that ground level, and doing some of that co-creation of the project. Like we've literally sort of had grants that have been written with Alexia's group. Um, uh, and so there's CBOs. There's also when you're thinking about your videos, your infographics, etc. I mean, Dr. Fran is a whiz at that. I can't create content to save my life, right? But Alexia, we were at what she referred to, and the content she created was amazing. So just recognizing, right, that you need to have sort of all the players who can fill in. So with any research, there's usually probably some type of video, infographic, educational flyers, even your flyers, etc., that you're going to create. I think reaching out, having, forming these relationships, having these partners who help you with that type of thing, so that it is accessible and better received. Because I think that's the important part. We whether if it's a grant, we have to recruit people, etc. We have to recognize the importance of it being attractive to the people we're trying to get to. And a lot of times us in our rooms alone can't get to that. So it's really just so important that we have from the ground up the inclusion of the community and others.
Yeah, and Dr. James, in your own research, what has your messaging design process looked like when it comes to communicating with fellow researchers or clinicians versus the community members you're hoping to affect?
Yeah, so I think that speaks to it. So I will usually sort of include. I'm thinking to an AHA grant that we have. I mean, so as we sort of mentioned, I think Alexia might have mentioned it, right? There's a lot of to fellow researcher, to fellow clinicians, etc. It's a lot of the data, right? That's how we think. What's the data that we want to implement this algorithm in our charts for detecting cardiovascular disease. And so we show the data that algorithm has done. It's improved things elsewhere, et cetera. And that's how we sort of tend to try to make the case to fellow clinicians and academicians. But to the community, we need the community because they're like, okay, why are you singling for some of the, and many of these diseases that might predominantly affect Black women or Black birthing people? Why are we being singled out is a question that can sometimes be asked. So we have to understand, we have to know how we're going to represent and structure even the questions around the idea, how we're going to convince. And so in this case, we had a panel of lived experience experts, and folks who could inform the video that we created that suggested that this was important, and how you talk about it, and how you talk about risk factors, and how you talk about being high risk, and inclusion of race in that discussion, and racism. So that's how we've done, and that video was amazing, I think, with their input from start to finish.
And Dr. Fran, from your vantage point, I mean, what kind of advice would you give to researchers who want to reach people on misinformation? I mean, do you repeat the misinformation? Do you try to go at it different ways? What's your advice at the moment?
I mean, I kind of approach it from several different ways. Sometimes I do share the content in a way where I try to make it educational about teaching people how to absorb content, right? So I talk a lot about like, okay, who is making this video? Let's go into their credentials so you understand that this person who is calling themselves a doctor is actually not a doctor of any sorts that's like recognized by the standard scientific community. Two, where are they giving you this information from? Are they citing their sources? If they're citing their sources, is it a study from 1987 or was this a recently published study in JAMA? Those are two very different things. Three, is there an ulterior motive to why they're sharing this? If they're, demonizing thyroid medication and then they're going to at the end of the video tell you that they have a link in bio for their thyroid supplement, like that's a little suspicious. And right, so sometimes I do share the content as a way to to educate the viewers on how you should consume content. Sometimes I will just take a clip and say, this person said this, let me show you why that's correct, or let me show you what the current recommendations are so that you understand. So I think it's actually helpful if you are someone who's trying to understand how patients are getting their information, that when you're approaching it, you kind of want to come at it from different ways too, because it's not just always the medicine. It's, can you teach people to be smart consumers of social media? Can you teach them how it's affecting them? And I know you guys, we have people in our midst who do that kind of research. How does social media impact how we view medicine or ourselves or what we're seeing? And so there's lots of different ways that you can break down the information that people are presenting online, but also how you can go about teaching people how to use that, because it's not always just the medicine, but it's also the viewing of that content.
Yeah, no, that makes a lot of sense. And we're going to be taking questions from the folks in a few minutes. So if you want to think of your own questions, please do that. This is for all three of you, really. What is one piece of advice you want to give to our audience members when it comes to combating misinformation and creating evidence-based messages that will resonate with their audiences?
I think if you're going to combat it in any way, you want to be able to cite your own sources. So if there's a way that, and it doesn't always have to be that you yourself are making the content. A lot of people ask me like, oh, how do I get involved in content creation? But I don't want to be a content creator. You can follow people who are already doing the work, right? Who you have seen have consistently brought forth evidence-based videos, tweets, Substacks, whatever, and share their content as a way to amplify their voices. But I think the most important thing you can do if you're yourself making any form of content is making sure that you can back up that with the study, the ACOG recommendations, the standards of care put forth by other colleges. I think that's always helpful and gives yourself credibility when it comes to the things that you're talking about.
Anyone like to add to that?
I can jump in. So some of the things that come to mind is remembering that people trust people before they trust information. And so I'm looking at it through the lens of, you are sitting there with someone as a clinician, as a researcher, and this is something that you either want to share in terms of information or give. And so yes to all the things in terms of why this information is good and how to combat it. And the one thing sometimes I think the simplest thing, one of the easiest things sometimes that we miss is we use that analogy about it takes or we quote, I should say, the African proverb, it takes a village, and it does. And we have to understand our role in this village. And so if your role happens to be the clinician, it's making sure that you remember you're in the community and not outside. And so if you are noticing this change and that people aren't being as receptive and they are quoting social media a lot more, then yes, point them towards those credible resources to second what you're saying. And also get into the environment to see where else they may be getting this information. I mean, there's churches, there's mosques, and faith-based organizations, other community-based organizations that can help you with curating the experience that our families really, really, really need. And again, remembering that we can't combat misinformation with just facts alone, going back to the relationship building, understanding that this is an emotional relationship here. And so while there may be a transaction happening right between you need care and I'm giving care, whatever that may be, but I should feel like in this moment that this experience is about me to the best of your ability within your constraints. We understand all the things that are being combated. But as the saying goes, people don't always remember what you say, they remember what you feel. And if it feels like you're sharing something or how you made them feel, and if it feels like you have my best interest because I've been seeing you participating and actively involved, then that's another way that it builds trust for me. And you're dealing with layers, especially in the Black and Brown community. You're not dealing with Alexia right here. You are dealing with everything I experienced, what came down through experiences of my family, what I know, and things that I don't even know. And so, as we're centering and elevating messaging around even mental health on this perinatal side, we just have to be very compassionate and we just have to be very mindful of how we approach even combating misinformation.
I never like to follow Alexia. I was talking about, I was muted. She has just stated everything, but I couldn't agree more. I think what I was going to say, you really do have to, as a clinician, meet people sort of where they are, and that really takes understanding. So you don't know what necessarily their experiences have been, but understanding why they're being receptive to the misinformation, I think, is key to then being able to try to address it. And the addressing is really in the ways we've talked about, getting that information to them that they can relate to. But unless you're understanding what the basis of that, desire to reach out somewhere else and to get the misinformation from someone else, I don't know that you will be able to address it.
Hmm. What are the biggest threats of misinformation that you see out there, and how do you combat them? And by biggest threats, I mean the most worrisome, the ones that really threaten people's health.
I mean, for me, the ones I see are the ones that acutely can make a life or death change for patients, right? So declining vitamin K, even things like declining Group B strep treatment during your labor, that can end in death. And that's like very terrifying. On a more like long term, when people fearmonger like cancer screening, I also find that incredibly problematic to try to scare people away from things like pap smears, mammograms, and colon cancer screening. We know we're so lucky that we live in a time where we have these options to screen for cancer and catch it either before it is a cancer or very early in cancer. And without those things, the chance of it becoming cancer are much higher. And that again can lead to death. So those are the big ones for me. It's, if someone doesn't want an IUD because they're scared of the pain, I get that, but you're not going to die. But your baby could die if they have a catastrophic brain bleed from their maybe not even that traumatic birth. And those are the ones that really weigh on me because we have seen babies and people die from this misinformation.
Mm.
I think what I've seen, there's a general like sort of reluctance for medication in pregnancy in general, and some of it is founded, some of it isn't. But I think in the mental health space, that's another area that we have to address with sort of nuance and especially in pregnancy. And so misinformation about taking medication, not. But then what also gets me with some misinformation is that the substitution is an herbal product or something like that. And I by no means want to knock that, but I think we need to sort of within that understand where there is education or information around the use of some of these things that are being substituted. Where's the source that they are bringing to promote those things? So it's just become so easy for people to, elevate something to treat something and then say no to the medication aspect of it. And I just worry about the proliferation of that practice.
I'll just say echo to everything Fran and Abike said. And one of the biggest threats too is the environment that allows for misinformation. So when we perpetuate the cycle of sharing inaccurate information, but also using accurate information as a weapon. So weaponizing even accurate information is extremely problematic. And I've heard it, I've seen it. And I think when we do things in areas like dismiss doulas, when we say, oh, you don't need doulas, we have, and I'm nothing against, the other clinical teams, but it's like, oh, you don't need a doula because we have nurses here and this is what they do. We all have a role. And so I think one of the threats is not being clear around all the information that needs to be shared with a family when they come in terms of all their options, even as it relates to coming through your care systems, that may be who they could interact with. Always use different teaching hospitals as an example, because you could interact with so many different levels of clinicians, especially when it comes to doctors. And I remember we did interprofessional education session one time, and it was literally transferring information for the doulas to understand the difference between like the resident, the attending, et cetera, and then what year resident they may be. And so if we are in these hospitals a lot, and so we'll probably come across this knowledge, or you may get it for instance, when you come through our doula training, these families aren't sure. And so I think that's one of the biggest things we just want to be mindful of that can threaten even this space of not just misinformation, but making sure a complete story is being told too.
So how do you persuade someone how do you move them off of misinformation? I mean, is it through values? Is it through other means, maybe more culturally adept means? How do you do it?
I mean, I think you have to sit down with them, right? First of all, sometimes it's hard because it might be the first time that I've met that patient. It's a lot easier when you have a relationship with the patient already to feel like you can have that open relationship where they don't feel like they're on guard and have to like prove their point, right? But I do think just sitting down and being like, hey, let's talk about what your wishes are. Are you okay if I share with you what my recommendations are? Can we talk about what your concerns are? Are there any things that I can help you if there's any questions that you have about this? I think it's really hard for clinicians at times because I think we come in being like, I can't believe someone's making this decision. This is a terrible idea. But the reality is, like Alexia said, that's coming from a whole different slew of places. That's coming from their aunties. It's coming from their people in church. It's coming from the people they saw on TikTok that they trust. And so, coming in defensive and strong is not going to like win them over, right? That's going to make them put up a wall and you're not going to be able to communicate. So I think really step one, at least as clinicians, is sitting down and having a conversation, like finding a common ground with each other and having, them trust you and having you have an open heart and mind to what they're saying. And sometimes, not always, I think there's a common understanding that you get to where they trust you because you're a person to them now, not just the mean doctor who walked in and told them that they needed to do this. Um, and that relationship helps work out the differences in decision making there.
And go ahead, go ahead.
Definitely agree with that. I would, add also depending on sort of the space and the population, cultural concordance definitely also helps, and is important and doesn't you don't have the burden of seeing every patient, but I think just even having on the team. So just really making sure that we do with all we're doing to have diverse perspectives, but also have a diverse team, so that you can sort of speak to that and be aware of the things that need to be addressed. But I do think that that is a fundamental sort of part of all of this.
I keep going back to seeing the person, that's sitting there. We are dealing with people who may be troubled about not having leave from when they have their baby, right? Or they have to go back, or whatever their circumstances and the social determinants of health and environmental determinants of health that they are navigating. But understanding that this person sitting right here cares about themselves. And they just need to know that someone else does. And I think that's a big part of it, is knowing that you sitting in front of me. And I'll be the first to admit, I know doctors, midwives do not have enough time to quickly, but I also have done it in a very short period of time. And so use your allies as well. So of course, I'm going to champion doulas. So we need more support in that area. We need more to advocate for what it looks like to have that consistency in care. And yeah, Medicaid is doing a little in terms of that, but we need that even to be broadened in scope. And I understand I'm preaching to the choir when it comes to expansion and policy and et cetera, but I think that we have to just keep seeing the person, and then where your ability and capabilities and capacity may be extended or overextended, start pulling in the rest of your team, those who may be in a hospital with you and those who may not. Some of them may be under the same payroll, but some may not be. But you do have allies out there. And so if you are caring about people, we will notice that. People can absolutely tell. And so if you're doing that, you will be invited into spaces that you invite others into to have more support.
And can you give me an idea? Have you actually mapped influencers who are helpful to you and can be supportive, or voices out there who can be supportive that maybe that researchers could also benefit from?
Yeah, well, yes, absolutely. So, community members, number one, like your doulas, your even those who are considered like block captains in the area, faith-based organizations, I think are heavily underutilized in terms of their relationship. One, because oftentimes, no matter the size, from the smallest to the largest in terms of their scope, they have an understanding of their community, but they may need the resources to be able to bring to their communities. And so I'll use an example again of what we did with our baby shower, or even our Women Know Your Numbers, right? We have thousands of people that usually come through. And this is where they may not be able to get things well, some cases we have done ultrasounds, but they may not be able to get the full gamut of those services, but they can get a lot. They can get mammograms and again, dental screenings, blood pressure, glucose, and that matters. And then referrals even back to their primary care. Many people don't have primary care physicians at this time. And I know that the switch between HMO and PPO and being uninsured for a while and coming back had a lot to do with that. But I think in the community, from faith-based organizations, again, doulas and other birth workers, social workers, those that are in the hospital and outside, and then asking those people working with the families, understand and see who cares there. And there sometimes may have to be, a cleaning of house. If you have people there that are clearly not concerned about the community, they may need to rotate into another ministry, if you will, within that space. But I think asking even those who work within these spaces that represent the community, who would you recommend that we partner with? Who would you recommend that we talk to? Because we do care.
And we have a question in the Q&A panel, and I encourage anyone who has other questions to step forward too. A lot of the sourcing that wellness influencers are citing come from the Weston A. Price Foundation. Has anyone encountered this in your work? The Weston Price Foundation? No, okay. So let's go back just to, again, researchers reaching out to the community, dealing with misinformation. How do researchers compete for attention while remaining nuanced?
Do you mean like online?
Yeah, online in particular.
Yeah.
Because it's a very noisy, and as you all pointed out, it's also rewards the most vituperative comments.
Yeah. I think this is a difficult thing for anyone who makes that type of content, is that we can't always rely on as catchy things. But I think there are ways that you can learn to be good at content making while staying within the confines of your, scope of practice and making sure you're remaining nuanced. And that part of that is like consuming content and like kind of analyzing yourself. Like, why did I stay to watch that video? Did they have good lighting? Were there words on the screen that caught my attention? Were they good at editing? Did they cut out all the blank spaces in between words? Why did I scroll away from that video? Is it because they took 3 seconds with their millennial pause to start the video and I was already bored? Did I not know who was talking, so I scrolled away? I think to be able to make good content, you have to be able to consume some of the content and analyze it and to learn how you yourself consume it so that you know how you can at least try to make similar content. I have to think a lot about like, when I make content, why did that video do well? Was it that I looked a little sassy in the beginning of the video so people wanted to hear what I was about to say? Is it because I put the words on the screen so people stopped to watch because they were interested? And analyzing your own content as you make it to be like, okay, why did that catch people's attention? And replicating that and improving upon that, and just making sure that you don't fall into the trap of doing what everyone else is doing. And that's fear-based like hooks. That's giving people like something that sounds scary but isn't based on anything. It's very easy to feel rewarded when your video does well, but if it's for negative reasons, then that's not furthering your cause either.
And I think staying, like Fran said, being authentic as well. So I know with AI, people feel empowered to do and create all the things. And then now we're starting to miss out on that authenticity again. And it came when we first introduced and saw the uptick of social media. There was a lot of doing it for the gram, and doing it for likes, if you will. And now, and I'm not saying anything negative about it. Obviously, it has many benefits. But I think, too, one of the things is that people are grappling with is now, again, what's real and what's not. And so the more authentic that you can be, then the more of a connection. So we go back to that connection, not preying on it, but giving folks an opportunity to make meaningful connection through it.
Now, say I'm a researcher and I have a project and I want to talk to you, Alexia, about reaching out to the community, getting some kind of community contribution. Like, how would you recommend I go about it, like soup to nuts?
Yeah, so depending on what well, let's say maternal health, if you don't already have relationships with community organizations, start with, again, what is coming up though in your area around social media. So this is where you could use the tool to your benefit to find out what is happening in your area. I recommend even sometimes for my families when they're looking to get involved, I'm like, well, let's go see what's on Eventbrite. Well, let's go see what so-and-so is doing in Philadelphia. Again, these are trusted resources. And if you're not sure who those are yet, you can start there in terms of seeing what's happening around you and then building up from there. But I think once you start to identify a place that you can use to start to learn more about what's happening, then you can start to work with some of those organizations as well. Because even with Cocoa Life, we started from a place, right, where we were able to grow over the last 7 years, but it came from a relationship that built. I attended a baby shower and I was learning more about what was happening. And this was all the way in DC, and then started to build relationship from there. And so in order to do that, though, you have to come from behind the walls, behind the desk, whatever you're behind, the doors. So I think that's one of the ways to do it. And then the soup to nuts part or the rest of it really is continuing building those relationships, continuing to find out what are the needs. So versus coming in and just saying, hey, we have this and we're going to do this. What are some of the things that you think would be ideal? Because what may be a research question to a researcher is just life experience to the person that you're talking to. I don't know that has happened to me, has been done is something that can make meaningful change. But when you talk about being restorative, we want to create an environment where we are with people, doing things with them, not to them or for them, but we're doing things with them.
And Dr. James, you would add?
Yeah, I would add to that because I mean I think that was sort of the boat we were in sort of years before in terms of establishing it. And I think it is so our connection with Alexia came through of someone who was doing right work with and with with a faith-based institution who knew her in a whole different department. So what I'd say is even if you don't have the connection, sort of trying to find someone who has the connection, so that you can then build on it. And then once you establish that relation or the connection, because it starts as a connection, you want to really be intentional about cultivating it. And I think that's where, on the side of institutions, Alexia sort of spoken to this a little bit, but it can't be transactional. It can't just be, oh, we need you to do this to add this input into our research project, right? It needs to be more. Co-creating is great. Writing them into grants is great. Ensuring there is compensation for the worth of what they're providing to you, and then being present. When we held our first community advisory board, we started with a, sort of what do you want from us, and that's where we were told we want to see you there in the community as well. And so and then being accountable, making sure we follow through with what is asked of us. And so then once it becomes like a more of a relationship, a true partnership, I do think it becomes easier. And so then if someone else in the department wants to do the same, has a different project, they can ask me. We have a trusted relationship, and then we can make that connection. But so it starts with sort of doing it, making sure there's the connection, and then being willing within your institution to figure out who has the relationships, and then building from there.
And Dr. Fran, do you have any tips for researchers just trying to break out of the academic cocoon and really either communicate with community groups through social media or just communicate to the world their research? Any last thoughts to unleash these folks? Liberate?
I'm here for the liberation. I think everyone is so smart and is so used to talking to each other who have a similar understanding of the words and topics that you are talking about. I think in one place that especially clinicians somewhat have training in is being able to take like the esoteric, very smart, fancy scientific words and trying to like bring it down to our patients' understanding. And that takes practice. It takes a lot of work to be able to take the scientific literature, the fancy statistics, all the smart things you guys are doing, and bringing it to a place where people understand it. But think of it as if you're trying to explain it to a 10-year-old, right? Like explain it to me like I'm 5. That exists for a reason. And so that takes practice. But I think you will really find that once you are able to bring these complex topics into a place where people understand it in words that they understand, in ways that they understand, in places that they understand, like YouTube or TikTok or whatever, I think the more you practice it, it's going to feel hard at first trying to bring these complex topics to like a YouTube Shorts video. But the more you do it, the more comfortable you'll feel translating that information for the public.
All right. Well, I want to thank all the panelists. You guys were a powerhouse group. Really appreciate your thoughts on reaching out to the community, reaching out on social media. May all your posts go viral, but not your immune system. So thank you.